I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. We're coming to you from the ANCOR Conference, the American Network of Community Options and Resources here in Chicago. I have a wonderful guest with us today, Catherine Thibedeau. Welcome, Catherine.
Yeah, thank you. Thanks for having me.
So, Catherine, I always like to start with our guest telling us how you came into this field of supports and services for people with intellectual and developmental disabilities.
Well, like we were talking last night, I said I needed a job, and I had never worked with anybody with intellectual and developmental disabilities. I didn't have really very much experience at all, and moved to a new state, and my background's in social work, and I found a job working at an ICF facility in
immediate care facility.
Yeah,
right?
Yep, and very quick path up to be the executive director of the agency within 2 years. So
what did you start at?
So my official title was something called a developmental training coordinator, which is a specific position in the state of Maine in our service, our ICF service system.
You know, you just gave a wonderful example. It's one of the things I like to talk about here, is this field as a career opportunity. And so many people I know have started, even at direct support professionals, and have moved all the way up the ladder to the top. And you did that in a couple of years, it sounds like.
Yeah. It was, it just really was being in the right place at the right time. You know, it was in going to college, it was sort of my, aspiration to do sort of the administration end of social work. Didn't quite think it was going to happen that fast, but I've been there now 20. So I've been in my position 23 years, and I've been with the agency for 25. So
wow. So tell us about the agency. What types of supports and services do you provide?
Yeah. So we are located in Maine. We are a private nonprofit.
And the name is?
Yeah, Independence Advocates of Maine, and we go by IAM as our acronym. And we provide waiver services, sort of residential, community, employment, pre-employment, a couple, 3 or 4 different types of residential models. And then we also have an ICF, intermediate care facility. And we cover an area of about, for Maine is like a long state. So we kind of do the middle third of the state is really our service area. Several hundred miles we cover.
Very good. So in addition to your roles with your provider organization, you also have a role with the state organization of providers, the provider network, right?
Exactly.
So tell me a little bit about what that network is, first of all, and then what you do in that.
Sure. So at a national level, ANCOR is a trade association that providers can belong to, and they
it is the leading voice of disability providers in Washington.
There you go. Yeah. And so they, on a national level, are the association that supports providers and are their voice in from a political perspective, from a training perspective, all different areas. And each state has 1 or 2 state associations that do the same type of thing on the state level. So in our state, it's called MACSP, Maine Association of Community Service Providers. And I've been involved with them for several years. I'm currently serving as the chair of their professional development committee, which is good. I got termed off the board last May, but I also have a role at ANCOR too. I am their consultant on a national level on the ICF service sector. So I provide them support in that area.
Okay, so in the state organization, tell me your role again.
Yeah, I'm the chair of the professional development.
Professional development. Yeah. So what does that entail? What types of things are you involved in terms of professional development? Again, relating this to as a field that people can consider as a career and how they can grow and, learn more.
So like you had said, many people start off as DSPs, direct support professionals, when they first come into the field, and then they can sort of grow and be promoted. And it's really a field where you can do pretty much anything, right? You can do, there's just so many different job opportunities from direct service and sort of that whole clinical line. But there's also, all of the back of the office stuff. So finance, human resources, administrative, maintenance. There's just really a lot of different career opportunities within provider organizations. And so at Maxby, we really were looking at ways over the past several years of bringing opportunities for professional development to provider agencies. So we have a pretty wide variety of trainings we do. We do sort of pandemic on. We've been holding webinars, and then we have an annual conference. We do this year was our first year we did a policy summit. So, just bringing opportunities for people to come and be able to learn about new ways things are done and really sort of grow as employees and give them a foundation for growth trajectory in their agencies.
So we talk a lot about this field being a field of support, and there's so many different levels of support. So basically, so Maxby supports the provider agencies and helps them. Really, I guess you disseminate information, help them grow, keep them aware of what's going on. Do you have any connections to maybe legislative things that happen in the state as well too?
We do, yeah. So Maine is unique. We are a state of a lot of small providers. So we have our association has 85 organizations that are members of it, and we work collectively. We're a very collaborative approach to getting our work done, and so we have a legislative committee that I'm also on that, and set our legislative agenda and sort of work through our state legislative processes while also supporting ANCOR, what we can do from a national perspective.
So one of the things that I always like to touch on is health and wellness and health equity in people with intellectual and developmental disabilities. Are there some things that your organization, on either your provider organization or Maxby, that are working on related to improving health and wellness in this field?
Yeah, I mean, I can speak to my agency. So we just recently put forth a project to our state of Maine, and we were awarded a grant to pilot the use of Station MD, which is a telemedicine, telehealth service. So it's not currently being used by any providers in our state, and we're bringing together a collective of 150 waiver participants, 150 Medicaid members, to be able to access the service over a period of time and provide some support, medical director support to provider agencies. And we really in our state are looking at ways to better support people with high acuity needs, whether it be behavioral health or medical health. So our system is set up where we have our ICF program in our state only supports people with high medical needs. So other than like a few outlier different programs. So it's small though. It's really, so most people are supported in the community settings, in group homes or independent living or shared living, regardless of what type of health needs they have.
Sure. What makes telehealth valuable, do you think, to people with intellectual and developmental disabilities?
Oh, so I'm super excited about this. We're a very rural state, and so just a trip to the emergency department for some parts of our service, for our agency, for our service is, an hour to a critical access hospital, 2 hours to a full hospital. So that's just getting there has all of its logistics, right? Someone needs to go be seen. in the emergency department, they're not feeling good to begin with, right? So just the logistics of getting somebody there, being there, being around people who maybe are very well-trained practitioners, but not necessarily
well-trained in that particular area of medicine. Yeah, and I can relate. I used to know those at one point.
Yeah, and so just the idea of having this opportunity that when somebody's not feeling well or something's going on, that they can call and be connected to somebody who this is all they do, right? All they do is work with people who have intellectual and developmental disabilities and providing them, medical care. So it just from a convenience perspective, and then just the quality, I think, of the care. I love the integration into their, it's not a replacement to their current primary care. It's an augmented service. So we're really excited about it. Any provider that I've talked to, we have several providers that are interested in joining us, are really excited about this opportunity.
Well, I'm excited for you and taking that initiative on, and pretty sure you'll be really pleased with it.
Yeah, I've heard a lot of great things.
So that's great. That's great.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So one of the things that I like to ask guests to do is to tell the audience 3 things, and I usually say 3 and 3. So 3 things in 3 minutes. I'm not going to hold you to it, but really, 3 things in 3 minutes that you can tell people out there, listeners, that you think could have an impact on the lives of people with intellectual and developmental disabilities in any way whatsoever. Anything you want to share?
So I think the first thing is to find opportunities to engage and interact with people with intellectual and developmental disabilities. If you sort of, pay attention and open your eyes to people within your community, you will see people, meet people, and it's really an amazing thing. And it's I think we have a long way to go as a country for people to be fully included in their communities. So anybody can do that, just simply getting to know the people that live in their communities. I think another thing I would suggest is being creative in employment. So if you own a company, work at a company, if you're struggling to hire people within your company, think about ways that maybe you could employ a person with disabilities, and it can be done in a lot of different ways. There's a lot of different creative ways to do it, and I think that people that sort of open their doors to that concept have had great longevity and success.
Yep.
And I think one thing that I like to say is, imagine if you needed help getting through the day. with whatever, right? You needed someone to help you get through the day. It's really important, and it really matters who shows up, right? And so at some point in all of our lives, we will either need caregiving or a loved one will need caregiving. And so when you hear on the news, when you hear in politics, sort of these initiatives that are going on for the caregiving community, it might sound removed to you, right? It might be like, well, that's not my issue, but someday it will be your issue.
And
like
in the
you
blink
will.
of an eye.
Yeah, it could be your, it matters who shows up, right? It really, really matters. If you need someone, especially if you're having someone support you with very intimate care, if you have high medical needs, that's a very, very complex, and you're very dependent upon somebody else. So for us, from the caregiving end of things, we really want to be able to create jobs where people can stay, they can be well compensated, so because we know truly that the importance of having that right person show up when you need that help.
Yeah. So great things to think about, important things to be involved in for sure. Catherine, are there some other thing, or is there anything else you'd like to share or to talk about?
I think that I just think about being here in Chicago and being at this training and all the work that ANCOR has done over the past. I mean, going back, I think this is the 53rd conference, but really the evolution of their impact on the service delivery system nationally over the past couple of years has been pretty amazing. There's over 800 people, I think, here at this conference.
I heard over 9.
Nine. Okay.
It's impressive. Okay. And I'll tell you, it is, I've been in this field for, 25 plus years, but only involved at this level and with ANCOR and for about 5 or 6 years or so. And I've seen a lot of growth and change, and it's really an impressive organization. I tell you, if any of you work with provider agencies out there and you're not a member of ANCOR, you should really think about it for sure. Yeah, I would encourage you highly. Yeah.
And, and I guess I would just give a plug if you're an ICF provider and you have any questions about the ICF program, or feel free to reach out to me and I'd be happy. It's like my favorite thing to talk about.
So how can people reach you if they want to?
Yeah, so by email, my email is cthibedeau@iamsupports.org.
Spell Thibedeau.
Yeah. So it's CTHIBEDEAU.
At what?
IAMsupports with an S on the end, one word, .org.
Excellent.
Yeah.
Catherine, thank you so much, first for taking the time out from the conference to be a part of this podcast, but secondly, for the work that you do.
Thank you. Thank you very much.